You actually had, I felt like a really difficult homework, which was like read this case study and tell us what's going on. You guys remember that homework? Anybody? Yes. Yes. Do you guys want to discuss that? Miss Nguyen, you had a question on it, right? About number 2? All right, don't, wait 1 second though. So can somebody volunteer to read the case study? So we know what we're talking about here?
I can.
Thank you.
If I can have a second just to pull it up, is that okay?
You can have all the time in the world to pull it up because I don't have my book with me. So I am unprepared and you are basically, and I am very appreciative that you're willing to read it. La da da da.
I'm just trying to get to where my assignments are. 1 second.
No, take your time. By the way, some of you. Oh, go ahead.
So if I'm on the canvas, because I'm doing it on my phone, do I go to dashboard or courses or what?
You'd go to, well, go to courses. Well, you could go to dashboard. Dashboard should pull is easier. Go to dashboard.
Got it now.
Good, and go to 120. And then go to assignments. I forgot it's in Canvas. I'm so silly. It's not just in my book. I could have pulled it up too.
Okay, so it is the intro?
It is number 23.
Okay.
And it is, assignment TG4 spine thorax intro.
Okay, I got it.
Okay.
Okay, Patricia is a driver for a major package delivery service. As a part of her work, she is sitting in her truck for many hours of the day and also lifting and moving heavy packages that she has to deliver. She's been working her route for about 7 years now. 2 months ago, she was unloading some packages from the truck, and a heavy package was accidentally pulled from a high shelf inside the truck. She caught the package as it was falling, but hurt her back in the process. She felt a sharp pain in the middle of her low back region as she caught the package. Ever since that time, it has been giving her problems during the day while she is driving, as well as when she is lifting packages. She often soaks in the hot tub when she gets home to help decrease the pain and ease her movement. Patricia did go see the doctor to make sure she didn't have a serious injury, and her physician told her there didn't seem to be any serious or long-term injury. The doctor said it was most likely a minor muscle injury and there would likely be some pain and muscle spasm associated with it, but it should get better as long as she is careful not to overload it too much.
Beautiful. And then there were questions about that, right? But before we get to the questions, I don't want to know what they are right now. Let's talk about this a little bit. Yeah? Because there was actually a lot of information in this. And by the way, when we get to the end of this, even if I have a conclusion, that doesn't mean I'm right. So be very careful as a massage therapist, because you kind of get out of school and you're like, this is what the problem is, I'm sure. You're never sure. You're just trying to make a good, logical guesstimation, and so that you have something to work on, like a plan of attack. But we're not doctors. We're not diagnosing, actually. We're just trying to give a guess at what's going on so we know what to work on. All right. So this person's sitting a lot. What happens when you sit a lot? Just really simply.
Your muscles get tight?
They get tight, yeah. They get tight and some of your muscles shorten, right? So that's a problem. So you've got some tightness and shortening. By the way, we won't get into it now because we haven't learned this part of the body yet, but a lot of your hip flexors, these muscles in front of your hips, get short. And that's a problem. Put strain on your low back. Later we'll discuss that. Then this person's doing a lot of lifting, which, by the way, some lifting is good for you, but that could put some strain on that too, huh? They've been doing it how long? Seven years. 7 years gives plenty of time for this shortening to occur, right? They've been sitting off and on for long periods of time for 7 years. You could really get some muscle shortening in there. And then this is the part that worried me. When you catch a heavy item really quickly, it's a very rapid motion. So picture if I've got these tight muscles and all of a sudden I take this rapid motion, it's a really good way to pull a muscle. Yeah. And so is the hot tub a good idea?
Yes, because it kind of will provide the warmth for the muscles.
Sure. Could it be a bad idea?
I don't know, you tell me.
So my only concern about heat is heat, just something for you all to remember. Heat feels fantastic on your muscles, right? It kind of loosens them up, right? But heat increases inflammation. So the general rule of thumb is if there's any inflammation present, don't do heat. The general rule of thumb, by the way, is, and that doesn't mean you should never do heat, I'm just saying if there's any doubt, if it's beyond a basic muscular tightness problem and there's any damage to ligaments and tendons, heat is actually not a good thing to use. And heat tends to feel better at the time but can make the inflammation worse. There is something you can use all the time, which is ice. Ice may not make it better, but it won't make it worse. There's no problem in the world that ice makes worse.
I have a question.
Yeah.
As far as massage therapists, are we allowed to recommend the heat or ice?
Yes.
Or not really?
Yeah, you are. You're allowed to do some really basic stuff with heat and ice, yes. And thank you.
Okay.
It's a really good question because you're right. You can't recommend all sorts of stuff, but you can recommend heat and ice. Alternating the two. Hold on one second. Do you need me? Oh, thank you, sir. Yeah, just slide in there. Alternating the two can be good too because the ice causes kind of, blood to be pulled in there for, one reason. The heat causes it to be pumped out and it creates a pumping action, going hot and cold. And pumping action is what you do with massage too. By the way, I'm not super worried about a hot tub heat-wise. It's not like a direct heat pack. I'd worry more about a hot pad on them. But I just caution you to be a little careful about heat. It's deceptive, and it doesn't necessarily do stuff, especially immediately after an injury. Immediately after an injury, they really recommend ice. Here's the trick about ice, though. "20/20. It should not stay on longer than 20 minutes, and it needs to stay off for 20 minutes then. You can keep going back and forth all day long if you want, but you don't stay on longer than 20 minutes because you could actually freeze the tissue and cause damage, right? And the nerves go numb after a while, and so they don't know. So 20 minutes on, take it off for at least 20 minutes. 20/20, 20 on, 20 off. You can go back and forth all day long, but don't leave ice on something longer than 20 minutes. You really could do some damage to the tissue.
So since she had this problem already for like 2 months,
Yeah.
in the beginning, it would maybe not have been a good idea for her to do the hot tub, but since it's been bothering her at the end of the day, would that have been fine?
Yes, and I'm sorry. I didn't realize it had been too much. You're absolutely right. At this point, you're right. It probably doesn't matter what she does, especially since the doctor, if the doctor's correct, by the way, and they do make mistakes, but the doctor said, hey, I don't think there's anything seriously wrong, and the doctor suggested it was muscular. So was it a strain or a sprain?
Okay, is the sprain for ligaments?
Yes!
Okay, so then it was a strain.
Strain, and think about it. I strain my muscles when I'm lifting. That's how I remember. I strain my muscles. So it was a muscle strain. That's great news. Because would you rather have a muscle problem or a ligament problem? Thank you. I saw.
Muscle problem.
Muscle problem. Why?
More blood flow.
Right. Muscles are vascular. Ligaments are vascular. Hey, without blood. So, and we discussed last week that they actually get blood, but they get way less than a muscle does. So muscles tend to repair faster too. Yeah. So you're right. I mean, things like massage, like this is the type of client you want to get, right? Because this is the kind of client that has some kind of muscular, fascial. I saw a lot of people put fascial responses in their answers, which was good. It's a good way to think. Anyway, a muscular, fascial, myofascial problem. Massage is really helpful for that kind of stuff. You increase blood flow, it gets better. You stretch stuff out, there's less pressure on it. They're getting some pain in the low back, probably some pinched nerves down there. Because what happens is when the body gets injured, it locks down. And when it locks down, it can lock down. We're going to learn about these muscles really soon. You got spinal erectors here. And when they lock down, they can pinch on the nerve plexes that come out to the side. And you can get a lot of pain. Anybody here had like really bad back pain? Yes.
Yes.
Yes. Did it make you feel like you were going to pee yourself?
No.
Okay.
No, what I talked about in lab, I had a herniated disc before and it was not great.
It's not great. People say the only thing that's worse is tooth pain, like you crack a tooth and stuff like that's pretty bad. But back pain is really bad because that's your main spinal cord. I wasn't trying to be funny about the pee yourself thing.
No, I do know that people feel that.
Right. It depends on where you herniate your disc, right? By the way, where did you herniate your disc? What level?
It was either L4 or L5.
What did I tell everybody? It's
right?
always L4, L5, S1, always.
Yeah.
Because that's where all the pressure builds up. But anyway, the reason I said pee yourself is because the nerve plexes from your lumbar region go around in front of your body and down your legs. So they control your bladder. And people with really bad injured backs will say, I feel like I don't have control over my bowels and stuff because all the nerves are pinched and it makes them feel very weird. That doesn't mean that always happens, but it's just it's that severe. Just trying to explain how severe it gets. All right, so it's muscular. Cool. All right, so what was question 2 that Miss Nguyen wanted to know all about? Can you read it to us, Miss Monreal? Are you there? You're muted, by the way. Okay.
Sorry.
That's okay.
What happens to the right side quadratus lumborum when you bend to the left?
Oh, okay. This is a really neat question. All right, can you guys see the skeleton here? Can you see my hand on it? Okay, the quadratus lumborum is about the size of your hand, and it looks like this. And it goes from my crest of my ilium here to kind of to my ribs and to the sides of my thoracic lumbar. And it looks like this, like 2 little hands there, right? So it's nicknamed the hip hiker. So we don't think about it, but when we walk, I have to lift this hip up so that I don't drag this leg along. So when we walk, you know, we kind of do a model walk when we walk, right? We shift our hips, right? But everybody does that to some extent. And this thing is called the hip hiker because it actually pulls your hips up like this. So I hope you can see that if the right side contracts, you will bend to the right or lift the right hip up. Can we see that? Because it attaches these 2 things here. So if it pulls, it will lift the right hip up or bend my body over. Does that make sense? I'm not getting faces that make...
So it's the same in the contract, right?
No, I haven't gotten there yet. So what I'm saying right here, if this hand right here, I don't know if this is right for you guys. Is this the right side for you guys? I don't know if my video is flipping it. Okay, it is. All right. Can you see that if it contracts, it's going to bend our skeleton over. It's going to pull it over. Or it's going to lift this hip up, but it's going to pull these 2 sides closer to each other. So the question is, if it contracts on one side, or if you bend to one side, what happens to the other? Well, what happens to the other side? What happens to the opposite side?
The muscles lengthen on the opposite side, right?
Yes, and I saw some people mouth that too. Yes, the muscles lengthen on the opposite side. It's a very straightforward thing. It's, it's very straightforward. So, Ms. Nguyen, yes. So, the quadratus lumborum on this side pulls me over. This side stretches. You can even feel stuff stretching over here. Yeah. The quadratus lumborum is a very important low back muscle to work. Very important.
Are you gonna go over, and I'm sure you are, but I'll forget to ask.
No, it's okay.
Why it said, that it's better, well, I don't know if it said it exactly like that, but
It's
to
okay.
work on it from the side, like with the person laying on the side.
Oh, I suspect they think they can get better exposure to it.
Okay,
I don't think it's necessary. I think you can hit it when they're prone, when they're face down,
okay.
really easily. Essentially, I do a little hooking motion. I can grab it and stretch the heck out of it. It's by the way, quadratus lumborum is actually an abdominal muscle. So don't worry, we're going to study it separately. Because this whole region down here where there's no thoracic, where there's no ribs, is considered the abdominal region. So your quadratus lumborum is considered to be the deepest abdominal muscle because it's all the way in the back. But when somebody is face down, it's the most superficial abdominal muscle from the back. You rub over it all the time. Or you should. Yeah. And it kind of hooks the hips into the lumbar region here. So anyway, the side, it laterally flexes the spine or elevates the hip to the same side as the muscle that's contracting, and it stretches the opposite side. Miss Nguyen, stretches the opposite side. Cool. Any other questions about that problem?
I think I kind of want to go over number one.
Please do. And by the way, let me thank you and a couple other people, by the way. You gave a really long, well thought out, detailed answer to this whole thing. I'm just commending you.
I thank you, but I don't think I really understood the actual question. I
Okay.
think that I just was thinking of different types of tissues
Yep.
and what could surface and then what would be next and then what would be after that kind of thing. And
Sometimes that's all we do, though.
Terms of tissues and what they
Yeah.
could be called and
Sure. So what was question one?
it was something about if Patricia's pain were right along the spine and the lumbar region, and was increased when palpating it, like the soft tissues in the region. What the name of the what tissues might be the cause of this pain? It was something along those lines. I don't know the exact wording.
Hold on, I'm going to pull it up. I think it's...
I can just read it. You want me to read it?
Yeah, please, read away.
Okay, it says, if Patricia's pain were on the right along the spine in the lumbar region and was increased when you palpated the soft tissue in this region, what tissues might be the cause of this pain?
Okay, so two answers to that, in my opinion. And we're getting into the realm of opinion here. If I got 25 massage therapists in the room, we'd all have something slightly different to contribute, okay? We just want to make an intelligent stab at this. So what is the quadratus lumborum that we just talked about? And here's why. Because when I palpate it, I make it tighter. So if it's like this and I palpate it, I'm putting it under tension. And so that's something that's kind of along the spine here, and it's in the lumbar region, and I can be making it tighter by palpating it, by pushing into it. So quadratus lumborum is a good guess, and I suspect what they're trying to steer you in that direction with the question. You know what I mean? However, this is an...
I guess I misunderstood the question. I thought they wanted to know, like, names of tissues.
Oh, but yes, muscle tissue in this case. Right?
That's
Or-
what I thought.
Yeah, so muscle is one of the 4 tissues. So in this case, they mean the quadratus lumborum, the muscle down here. But here's a whole other thought process that would go through my head. I honestly would, as a massage therapist, would not know that it was the quadratus lumborum from touching it. And it's rarely one muscle, right? So some people put in here like thoracolumbar aponeuroses, which is just all the sheet-like aponeuroses in this area. Yes. You have spinal erectors that come down in this area. Yes. You've got some muscles we haven't learned about yet called the multifidian rotatories that shoelace through here. Yes, it could be those. Quadratus lumborum, it could definitely be. You've got some transversospinalis, and don't even worry about these yet. We haven't gotten to them. And muscles that are woven down in here too, and it could be those too. So it could be anything down in that region. And I would massage them all. So Ms. Petrie, I think part of the problem with the question is I don't think it has a clear answer. I think just getting you to look down in this area and say what muscles are down here, any of them could be the culprit, all of them could be the culprit, and I would loosen them all up. So the fascia is not a muscle. Thoracolumbar fascia is a sheet-like tendon back here that a lot of stuff weaves into. But so that's a culprit. Fascia does have nerves in it, and it can cause problems. But then I would also look at the quadratus lumborum, spinal erectors, multifidi rotatories that are woven through here, some things called the transversospinalis muscles that are very deep down in there. Those all could be problems.
Okay. Yeah, I think I'm just confused then.
I think maybe you're making it more difficult than it needed to be, because I don't know that it's an answerable question in totality. Like, it's just what muscles down there could be a culprit. And so any muscle down there could be a culprit would be my answer. And then you list a few.
Oh, okay. Yeah, I wasn't thinking names of muscles. I was thinking names of tissue.
I know. So when you think tissue, you think like skin or fascia, right?
Right.
But in anatomy, there are 4 main tissues. Connective tissue, which is like fascia.
Yeah.
Epithelial tissue, which is actually skin, and other things. Nervous tissue, like your nervous system, and muscle. So they include muscle as tissue. So when they say tissue, they could very well mean muscular tissue, which is muscles.
Okay.
Yeah. So saying quadratus lumborum is naming a tissue, a muscular tissue.
Okay.
Yeah, you're right. That helps?
Think like connective tissue and circulatory blood systems and.
I agree. It throws me off a little bit too. I would expect them to say what muscles, what muscles. But I think what they're trying to do is get us to all realize that it might not just be muscles. It might be aponeuroses. It might be ligaments. It might be anything. So they're trying to get us to expand our thinking, right?
Yeah.
But anyway, yes. I hope that clears that up at least a little bit. Any other? Good. Any other questions about this thing? We're just trying to engage you in thinking about posture and stuff, which we're going to get into much heavier later. All right.
Can we talk about I'm sorry, Martha, can you read off the number 3 was about the stretching?
Cool, please.
Would you mind?
Now, what did you ask me to read?
Number 3. Number 3.
Okay.
Please, if you would.
Okay, if some of the muscles of the erector spinae group were particularly tight as a result of this accident, how could Patricia stretch them?
Awesome. So, we haven't learned about the erector spinae muscles. However, they are the first muscle we're going to learn about in this section when we get to it. But you stretch a muscle by doing the opposite of its action. These are long muscles that kind of go back here like 2 ropes, like ponytails all the way down to your butt. If I pull on those muscles, what is my spine going to do? What's this called? Please, somebody.
The flexion? Or it's one of those.
Which one is it? extension. Yes, it's going backwards. It's an extension of my spine. So when this muscle contracts bilaterally on both sides, it causes an extension. If it goes unilaterally, it can cause what are called lateral flexions. But anyway, if this contracts it and thus shortens it, what would lengthen it?
Flexion.
Flexion. Flexion of the spine. Touching your toes.
Oh. See, I just started writing down names of actual stretches. I'm like, he's not going to know what I'm talking about. These are just names of different stretches to do.
Well, I might have been.
That's why it says at the beginning, like, that it doesn't matter what our answers are. We're just trying to make us use our brains.
Yeah. When I look through your.
You don't get them wrong.
Yeah. When I look through your stuff, I'm like, did you put effort into this? Did you actually think about it? Did you give me an answer based on some form of logic? I don't look at whether I actually agree with it. Does that make sense? You know, I just don't want you to write on there, number 2, because I said so. Like, that's not an answer. I want you to, I want you at least like if something's pinched down here, you better name a muscle down here. If that kind of stuff, just some general stuff. But anyway, yes. So to stretch that, we do the opposite. And the idea is that would stretch out the muscles.
Bending over, touching the toes.
Yeah, would stretch out the muscles because you're creating a flexion of the spine. You're also flexing the hips there too, but you're getting the spine too.
And so answer in the chat, right?
Flexion. Yeah, flexion of the spine. By the way, lateral flexion would stretch each side too. Lateral flexion would also stretch my quadratus lumborum. So those would be good homework for the client. It's good to give them a little bit of homework to do. Good homework for the client. By the way,
I have one question more,
please.
but I saw answer in the question number 5, but I don't understand any more than that.
Okay, so let's see. What's number 5, Miss Monreal? Since you're our official reader today.
Okay. If it appeared that the multifidi, I don't know, how do you pronounce that?
Multifidi, that's how I say it.
Multifidi were involved in Patricia's pain complaint, why might you want to continue treatment through the full length of the spine all the way over the top of the sacrum?
All right, they're leading the witness. Okay, the answer is very simple. By the way, not simple to you guys, and I don't mean because you're not smart, I just meant like it wouldn't, but the book is looking to try to have you answer something very specific. So the multifidi are this shoelace-like muscle that literally looks like shoelaces, and it ties your spine together. It's very deep in there. And it runs all the way down to the sacrum and actually over the surface of the sacrum. And so they're looking for you to acknowledge that. They're looking for you to say, well, of course I'd go all the way down because the muscle runs all the way down and even runs over the top of the sacrum. They're just trying to teach you about the anatomy of that muscle, and they're leading you with this question. But it's because the multifidi actually goes down the whole spine and over the sacrum. So in the beginning, when you're a massage therapist, we tell you don't run into bone, right? But later, we actually want you to run into bone and run over bone judiciously. That means with judgment. So I might go really deep down your spine, and when I get to your sacrum, don't stop. Come up on the sacrum and kind of scrape the muscle off the sacrum. Different level of pressure, different angle. But I don't want to stop there. In fact, a big mistake a lot of massage therapists make is they don't even quite get through the whole low back. They kind of come out at the end. And that's where they need to be going in deep. And then when I run into the sacrum, I come up on it and kind of scrape the muscle off the sacrum. It feels amazing. Anyway, Miss Monreal, what were you going to say?
So is it rotaries? How do you pronounce that one?
Rotatories.
Rotatories. Okay, so they're the shoelace ones, right?
And so are the multifidi, by the way. They're both shoelace.
Okay, that was my question.
The bit, well, there's two differences between them, but one of the obvious differences is the multifidi goes all the way down and covers the sacrum. The rotatories don't.
And is it all one muscle, or are they just little ones?
That's a great question. They are just little ones.
Okay,
But because they run in a uniform pattern, we call it all one muscle.
okay.
You know, it's convenient, especially for what we do. It's really convenient. But really, it's a whole bunch of individual shoelaces. You're right. They go from spinous process to transverse process on another thing, and it's actually, I don't know, 48 different muscles. But anyway, we call them the rotatories and the multifidi. These are really good questions. And by the way, we're going to study the rotatories and multifidi and the spinal erectors and the quadratus lumborum. So don't worry about this being kind of like vague right now. I hope you've noticed this is what we kind of do in this class, right? We kind of talk about something, we kind of build it up, then we talk about it specifically, then we weave it into stuff. Yeah, we're just heading there. Yeah. Cool. Okay.
It's like foreshadowing in movies.
It's actually really well said. It's exactly what we're doing. I don't want the first time you ever to have heard rotatories the first time I talk about it. So at least you're like, oh, that's that weird, what's a shoestring thing in the back? Perfect. Now we've got, you're right, we had foreshadowing, we've got some subplot going on, and now we can talk about it more. Yeah, well said. Anything else on this question? It served its purpose, I'll tell you.
So they were just trying to get us to understand. It seems very basic, but the way they worded it was kind of like.
That's why I meant they were leading the witness. They wanted a very specific answer, and I don't. In this case, I don't like that. I think they should have given you some more general stuff. But, you know, I don't write textbooks, and it's fine. You know, it's all good. Okay. Anything else on this? I'm only waiting a second because the last couple times I asked this, somebody's like, well, maybe. No? Okay. All right. Thank you to our esteemed reader. Thank you for all your great questions, really seriously. And thank you for those of you who put in like really long, thought out answers, even if you were answering different questions. Let's do a little quick review. Take a test that I think you'll have no problem with so you don't have to take it tonight. How about that? Yes. Maybe get a little bit of your life back. Yes. Okay. So we've been talking about the spine and the thorax, right? Spine and thorax, spine and thoracic region. Yes. Cool? Cool. Miss Torres.
Yes.
What section of the spine is this?
Cervical.
Good. How many cervical vertebrae are there?
7. C1 to C7.
Good. What's C1 called?
Atlas.
Good. What's C2 called?
Axis or
Yeah.
axis.
Axis. Atlas and axis. Yeah. Guy holding up the globe and then the axis turning around there. Yeah. Very cool. And do you remember what C7's called? It's not in your book. So.
I know, but I don't remember.
It's very prominent. Sticks out.
Spinous prominence.
That was great, actually. Vertebra prominence. Vertebra prominence.
Oh, okay.
Cool. So vertebra prominence. What is the unusual feature of C1 atlas?
That it doesn't have that transversive.
You're close. It's got these.
Yeah, they're called.
It's got the.
It doesn't have the spinous process.
Yes, so that I can do this. Perfect. Thank you. Miss Felix Osuna.
Yes.
What section of the spine am I holding here?
That's the cervical.
Thank you. How many cervical vertebrae do you have?
There's 7.
Cool. What is C1 called?
Cutlass.
Yes. What's unusual about it?
It doesn't have the spinous process.
Yes. Thank you. What's C2 called?
Axis.
Thank you. What's C7 called?
Is it the prominent?
Prominence. Yeah. Vertebra prominence. Perfect. Thank you very much. Miss Bilotic.
Yeah.
What section am I holding here of the spine?
The cervical vertebrae.
Yeah. How many are there?
7.
Yes. What is C1 called?
The atlas.
Yes. What's unusual about it?
Because it's missing the spinous process.
Perfect. What's C2 called?
The axis.
Perfect. What is C7 called?
The 7th cervical.
It is called subcervical or vertebra prominence. Good job. Thank you. Mr. Kandaris. Mr. Kandaris, what region of the spine am I holding here? Mr. Kandaris. Hey, what region of the spine am I holding here?
Thoracic.
Cool. How many thoracic vertebrae do you have?
12.
12. How many ribs do you have?
12.
On each side. Perfect. One other thing I didn't tell you guys, but I'm going to tell you, Mr. Kandaris, because I'm going to be asking other people, is your scapulas, when they're kind of sitting here at rest, tend to rest between T2 and T7. So like the superior angle of the scapula is around T2 around, and the inferior angle is around T7. So the scapula tends to rest between what two thoracic vertebrae? Sir?
Sorry.
The scapula tends to rest around what two thoracic vertebrae?
Looks like 2 and 5.
2 and 7. T2, T7.
Okay. Little lower. Alright.
Thank you, sir. Miss Hunter. Hi, Miss Hunter.
Hello.
Hello. What region of the spine is this?
Thoracic.
Cool, cool, cool. How do I know it's the thoracic region of the?
I just remembered because it's near the ribs.
Yes, all thoracic vertebrae attach to a rib. All thoracic vertebrae attach to a rib. In fact, ribs and your sternum make up the thoracic area. Ribs and your sternum make up the thoracic area. It's almost like he's going over this stuff for a specific reason. Anyway, how many thoracic vertebrae do you have, ma'am?
12.
12, cool. Okay. And the scapula often will rest between what two thoracic vertebrae?
T2 and T7.
Well done. By the way, that's an anatomy thing that they're really into to help you find the scapula. I don't really like it because it's really easy to elevate the scapula, depress it, or move it away from these. But that just gives you a place to start looking for it. It also gives you a way to kind of figure out where T2 and T7 are. Cool, cool, cool. Thank you so much. Miss Nguyen. Hi, Miss Nguyen.
Yeah.
What region of the spine is this?
Thorax, yes.
That was really good. Thor,
Thor,
ass, ick.
is thorax.
Thoracic. Thoracic region. How many thoracic vertebrae do you have?
12.
12. How many ribs do you have?
All the body have 22, right?
24. 12 on each side. 12 on each side.
Yeah.
Because they're all attached to a thoracic vertebrae. Cool. My scapula can be found kind of at the level, can be found between two thoracic vertebrae. T2?
And 1, 2, and 7.
T7. Well done. Thank you.
Yeah,
Cool.
thank you.
Hey, you did so well at that, Miss Nguyen. What region of the body is this, of the spine is this?
Cervical and the
That was perfect. Cervical vertebrae.
yeah.
What is C1 called?
Atlas.
Yes. What's C2 called?
Axis.
Yeah. Do you remember what C7's called? This one's hard. It's under your book. So we'll take 7 cervical or vertebra prominence. That was beautiful. Awesome, awesome, awesome. Okay. Miss Stanley. What region of the body of the spine is this?
That looks like lumbar.
It does look like lumbar. How many lumbar vertebrae do you have?
5.
5. What's the first one called?
L1.
What's the last one called?
L5.
What comes after L5?
The sacrum.
Yes, that's correct, which we sometimes call S1, but it's definitely the sacrum, and you are 100% correct, and thank you very much. How good are you at math?
Oh, I'm terrible at it.
Good. Let me ask you a terrible math question. How many, since we have 7 cervical vertebrae, 12 thoracic, and 5 lumbar, how many vertebrae do you have?
24?
Yes. I thought you were terrible at math.
I am, but I was already counting on my fingers as
Oh.
soon as I realized what you were doing.
That's really good because you don't even have 24 fingers, so I'm very impressed. Awesome. By the way, everybody, it's kind of interesting. What's 7 plus 5?
12.
12. How many thoracic vertebrae do you have? 12. So 12 plus 12 is 24. You have 24 vertebrae in your back. By the way, fun little fact, some people have 25. Some people have an L6. It's very thin. And I don't know that, I've never felt it and been like, oh, you have an L6. I just have seen it in x-rays.
My mom has one.
Your mom has an extra one?
Mm-hmm.
Well, la-di-da. Does it bother her at all? What? Yeah, a lot of people, it really, for some reason, it bothers them. It's not sitting there right. It's a funny little, like, smaller vertebrae.
And I think hers might be lower because she said that it might actually be an extra coccyx, not in the lumbar.
Oh, that's possible too.
She said it's either L5 or it's a coccyx.
Well, that'd be really
Can't
low.
remember which one it is.
Got it. But it bothers her.
Yeah.
Cool.
Yeah,
cool.
for a lot of problems.
Awesome. Hey, since we're talking, how many vertebrae do we have, Miss Petrie? Total.
24.
Cool. What is C1 called?
C1 is called the Atlas.
Atlas, guy holding up the planet. What is interesting about this vertebrae?
It does not have the spinous process.
The thing sticking out back it does not have. What's C2 called?
C2 is called the axis.
Yes. What's C7 called?
I'm sorry.
What's C7 called?
Prominence.
Yep, vertebral prominence. Well done. The scapula tends to ride between the level of what 2 thoracic vertebrae?
T2 and T7.
Fantastic. Yeah. And your ribs plus your sternum make up what area of your body? Don't overthink this.
Your ribs plus your sternum.
Yeah.
The thoracic.
Thank you. Thank you. Thoracic. You're perfect. You're perfect. You're perfect. Cool. All right. Let's talk about this little sucker here. It's hard to see on the camera. So when I hold it like this, everybody, it's actually like this. I mean, these are lumbar vertebrae, but my point is, this is the stuff that's poking out somebody's back. You can't even touch these things on the side, really. And the spinal cord is actually, you wouldn't even see it. It's hidden inside the bone. You can't even hit the spinal cord if you wanted to, but this is the spinal cord. The only reason you can see it here is there's not another vertebrae on top, because this is just a model. But real spinal cords are hidden inside here. You can't get to them. I mean, you can with a bat, but you can't with your elbow even. Now, you can kind of get to these little transverse nerves that come out of the side, and you can kind of pinch those. Not damage them, but pinch them. Anyway, so let's see. Miss Harper, Hi, Miss Harper. Miss Harper, what are these pointy things poking out people's backs called? Yeah, they're kind of these pointy things coming off the back of the vertebrae that poke out people's backs. Right here. They're pointy, they're kind of processes that you find in the spine.
Spinous process?
Oh my gosh, yes. Spinous processes, cool. What are these things coming off the side? Kind of like a transverse plane. What are these called?
Transverse process.
Yes. Very good. Spinous process, transverse process. These are really important, by the way. Later we're going to find out muscles attached to these and allow you to bend your spine in all sorts of ways. That's what they're there for. Very cool. Thank you. Miss Monreal. What are these pokey things that come off the back of the spine called?
Okay. Hold on, the ones on the side are transfers. That is spinous process.
Very good. Thank you very much. Hey, what's this big thing here called?
I don't know if that was the...
This is the body of the vertebrae. You were about to say laminar groove, which is between the spinous processes and the transverse processes. That's good, though. And this is the vertebral disc.
Mm-hmm.
Cool. All right. Awesome, Miss Hanson. What are these little pokey things that come out people's backs called?
Spinal processes?
Yes. What are the things that come out the side called?
Transverse processes?
Yep. What's this thing called up here?
I know you just said it, but I don't remember.
Well, I don't know. It's got a lot of body to it. Yeah, body of the vertebrae. Cool. And what's this thing in here called? It's your disc. It's your vertebral disc.
Vertebral disc.
Cool, cool, cool. And what's the space here between the spinous processes and the transverse processes called?
The laminal groove.
Laminar groove, yeah. Laminar groove, laminal groove, that's fine. That was good. That was really good, everybody. By the way, I know I hope that you all know that I know that when somebody asks you a question in front of a group of people and puts you on the spot and you don't know exactly what they're going to ask, that it's extremely hard while you're nervous to pull that information out of your head. I expect you to mess up, all of you. So I just hope you know that. We're just training you. And I'm doing it so that you're very comfortable in front of clients. If they're like, well, my blah, blah, blah muscle, and you can start to pull information out. But I expect it to be difficult. And I expect you to sit there and go, you just said it, I know, and that kind of stuff. So this is normal. This is to be expected.
Can you tell me the name of the inside of the thing again?
The lamina groove?
No.
Oh. The vertebral disc. The disc of the vertebrae. Vertebral disc. It's a big, squishy, really hard, really hard, but hard in a soft way. It's like an inflated tire in there.
Okay.
When you herniate your disc, everybody, by the way, so this is really cool, actually. It's not cool when you do it, but you've got these nerve plexes, remember, that come off the side, the branches of the tree. Here's the trunk of the tree. There's branches that come off every side out of every vertebrae. Well, when you herniate a disc, the disc gets pushed out the side here and pinches on this nerve. That's disc herniation, or a blown disc, or whatever people call it. But the disc actually gets pushed out, it squeezes out because it gets ruptured, and it pushes on the nerve. And it hurts because it's pushed on the nerve. So when you come to class today, I will have this up on the thing here. Take a look at it. Yeah, this is a healthy disc because it comes back and it's not squirting out. But if it actually gets under so much pressure, and over time, it can actually kind of, part of the inner core can come out and actually push on this. And that's a herniation of the disc, or a rupture of the disc, or a blown disc. People call it all sorts of stuff. But it's pinching on these nerve plexes that come out the side of the spine there, and whoo, you're in for a ride. Yeah. So anyway, that does not mean that all back pain is caused by that. You could just have a tight muscle over those nerves, but you could also have that herniation of the disc. And in massage therapy, we just try to loosen up that area so there's not pressure around it when that happens. Cool, cool, cool. All right.
I have one question.
Yes.
So how about when the old people when they in the pain, all of that? What happened with that?
Well, it could be a lot of things. Unfortunately,
Yeah, and the red and the very in
the disc.
pain.
So one of the things that seems to happen to some people with age, I want to be very clear, not everybody, because I don't want to associate this completely with age. So some people just, maybe they take better care of themselves or whatever, but some people seem to kind of lose hydration, literally lose water as they age, and these areas kind of dry up and they deteriorate. And eventually you get this disc starts to get really flat and you start to get bone on bone. And that's not even as big a problem as it sounds. Then these things come down really close and they start to pinch on these nerve plexes. And that's a problem. And so it's called degenerative disc disease. The disc is degenerating. It's wearing away. And it's degenerative disc disease. And it's a problem. Yeah. And it's part of the reason that we shrink as we get older. So my mother is getting shorter, God bless her. but what's happening is, now some people are hunched over. That's a postural thing. That's them not maintaining their posture as age. But if that's not the problem, if each of these discs starts to degenerate, let's say you lose like a couple of millimeters here and you've got 24 of them, you can lose a couple of inches. And that's why it kind of seems like some people, as they get really old, they start to shrink. They start to get shorter. They are getting shorter. The space between their discs is going down. Yeah. Did that answer your question, Miss Nguyen?
Yeah, and so that's why I asked you the white people very tall and after all, and I see them very short. But I think they do that.
Yeah. Usually two things happen. Usually the disc generation is happening, degeneration. So it's getting shorter. That's happening times 24 discs. But the other thing is sometimes people start to kind of hunch over too, and that makes them a little bit shorter too. Yeah. So one is posture. The other one is degeneration. Yeah. So watch your posture, everybody. Okay. Miss Yanis. Before we take the test, Miss Yanis, can we review everything we just talked about? Good. Okay. Miss Yanis, hey, my ribs and sternum make up what region of my body?
The thoracic.
Thank you. What region of the spine is this?
The cervical.
How many cervical vertebrae do you have?
There's 7.
What's C1 called?
The atlas.
What's interesting about it?
It doesn't have a spinous process.
Thank you. Why?
Because it did, you wouldn't be able to bend your head back.
Yeah. Thank you. What is C2 called?
Axis.
Yes. Why is it called axis?
Because it's what helps you rotate your head.
Yes.
Right?
It's got a little thing sticking up and helps you rotate your head. What's C7 called?
The vertebra prominence.
Yeah. After C7, what is the next vertebra called?
T1.
T1, because you're now in which region of the body?
The thoracic.
Yeah. What is going to be attached to T1 out the sides here? For sure. And T2, and T3, and T4.
Ribs.
Yes, thank you. I realize that could have been something else, but thank you. That's what I meant. Yeah, the ribs are attached to it. That's why it's thoracic region. What can I find between T2 and T7 most likely?
The scapulas.
Thank you. Yeah. The superior and inferior angle of the scapula. The scapulas. Well done. How many thoracic vertebrae do you have?
12.
Yeah. What's this area down here called?
The lumbar.
How many lumbar vertebrae do I have?
5.
What's the last one called?
L5.
Yep. What comes after L5?
The sacrum or S1.
Thank you. What do we call the joint between the last lumbar vertebrae and the sacrum?
L5 and S1.
Yes. Really good. Awesome. Okay. You're on a roll right now. What do we call I'm going to switch things up here a little bit. What do we call the stuff that comes off the side of the spine? These processes come off the side.
The transverse.
Yes, like the transverse plane that goes through us. Good. What do we call the stuff that comes out the back?
The spinous process.
Yes. What do we call this big piece here?
The body.
Yes. What do we call this right here, this red thing?
The intervertebral disc.
Even better than what I said. Yes, the disc between the vertebra. Intravertebral disc. Thank you for being a better teacher than me. And what do we call the groove that's created between the spinous processes and the transverse processes?
The lamina groove.
Lamina groove. All right, everybody, that was fantastic. Thank you. Everybody, let's take a test. I'll be here to answer questions if you have them, and that way you will not have to take it tonight, which will be good. Hold on, let me load it up here. And it'll kind of finish us up with the bones in this area. I don't mind if you use your book for this, because it still works. All right. Boom. It's number 24 test.